What are the alternatives to a root canal? Root canals are one of the most common procedures in dentistry that can be used to fix a tooth which is infected or decayed. Though root canals can be needed to save a tooth and relieve the pain of a tooth, they can also be expensive and take a long time to complete. For those who hesitate to undergo a dental root canal, you have alternative options to consider. In this short video, we'll explore a few possible alternatives to root canal as well as look at their advantages and disadvantages. 1. Antibiotics and pain medication. A different option for the root canal procedure is to treat the infection using anti-inflammatory drugs and pain medications. This method is best to those suffering from small infection or who are not having intense discomfort. Although antibiotics are able to rid the body of infections, they're not the best long-term option or successful in treating the more severe infections. A painkiller can ease discomfort temporarily, however, it cannot treat the root of the issue. 2. Pulpotomy. A pulpotomy is an operation that removes the affected or infected pulp from a tooth. Contrary to a root canal, which requires the removal of all tissue and nerves of the tooth, a dental pulpotomy eliminates the pulp from the dental crown. The procedure is usually employed in the case of baby teeth when the root has not yet fully developed. A pulpotomy is a great option to relieve pain and also save the tooth. It's not a permanent fix and might have to be followed with a root canal later on in the future. 3. Extraction. In some instances, there are situations where the most effective option to having a root canal might be to take out the tooth entirely. Though this could seem an unorthodox option, however, it could be an alternative for those who are not able or willing to undergo an operation for a root canal. Extractions can alleviate pain as well as prevent the spread of infection onto the other teeth. It is nevertheless essential to take into consideration the long-term effects of losing teeth, for example, changes in dental alignment, as well as the need for alternatives to replace the tooth, such as dental bridges or implants. 4. Laser therapy. Laser therapy can be a safe alternative to the traditional root canal treatments. Laser therapy uses lasers to clear infected tissue as well as bacteria from your tooth with no drills or anesthesia. Laser therapy is more comfortable and precise than traditional root canal therapy, which can also help to protect much of the natural tooth structure. There are a few dentists who have laser treatments, which may not be the best option for every case of decay or infections. 5. Herbal remedies. There are some who decide to investigate alternative therapies or herbal treatments in order to treat tooth pain without the need for an operation for a root canal. Some of the most common herbal remedies for tooth infection are clove oil as well as tea tree oil and garlic. These remedies can be helpful in reducing pain and inflammation. They're certainly not meant to replace expert dental treatment. You should consult with your dentist before attempting the herbal treatments, since they could not be successful to treat severe dental tooth decay or infection. In the end, there is a variety of alternatives for a root canal which could be worth considering who feel hesitant about the procedure. The options range from painkillers and antibiotics to laser therapy as well as herbs. There's various options dependent on the severity, the condition, and individual preference. It is crucial to talk with a dentist in order to decide the best method in treating tooth infections as well as maintaining dental health in the longer term. Keep in mind that prevention is the best treatment. So make sure you keep your mouth clean, floss, and brush regularly. Go to your dentist on a regular basis for appointments and deal with any dental problems promptly in order to prevent the necessity of surgical procedures such as root canals.